Hello, everyone, and welcome to tonight's Monday Night Coring. The theme, as you can see, is understanding core implementation concepts. We're going to cover tonight the 80% rule. We're going to cover small, medium, large, which is morphed into directed system support, DSS. And we'll also talk about phases 1, 2, and 3. I wanted to put one module together because it's really hard to talk about one of the themes without bringing in the other themes as well. So let's try to talk about them individually for a moment. So let's recap. So an 80% rule, when we're talking about a practice, it's the main need of the patient base. Every business, no matter what it is, has an 80% rule. The majority of their customers or clients are coming to them for a specific need or service. For makeup artists, it might be 80% of their clients are women. For wedding planners, it might be 80% of their clients are heterosexual couples. And the other 20% would be same-sex couples. I don't know. I mean, it's different. For the unfranchised, it's sort of flipped. 20% of the people that you bring into our business will do all of the work. And unfortunately, 80% are going to be what we call stable and waiting. Generally speaking, if you're on a rock star team and you are interviewing well and building deep and solid with quality people, then you may find that to be different. And I hope that the 80% rule is people who are actively building, whether it's through nutraMetrix or any of our other wonderful divisions. Okay, so every business has an 80% rule. When we are implementing, we are thinking about small, medium, and large options that are going to support the 80% rule need. And we're going to talk more in depth tonight about small, medium, and large. But the reason why small, medium, and large exists is because that's how we, as a society, know how to purchase things. We have three options, and generally, we're going to gravitate towards the medium option. And then the theme of implementation phases. So phase 1 is putting together a directed system support, small, medium, large option, that will make sense in a little bit, that supports the 80% rule of the practice. That's what phase 1 is. Phase 2 might be additional support for the 80%, or it might be going to the 20% or fractions of the rest of the 20% to support the practice as a whole. So I think I hope those are concepts that are easily understood. Every business has a large majority of their clients or customers that come to them for a specific reason. As a society, we know how to purchase things on a small, medium, and large option. And when it comes to implementing in a practice, the first phase is to target the 80% rule of the practice. And again, I'm going to repeat myself. Phase 2 might also be to support the 80% rule, but to support them, for lack of a better phrase, more holistically. All right, so let's talk a little bit about the 80% rule. That's the primary focus of the practice. It's the bread and butter. So for a cardiologist, patients are going to cardiology for heart concerns. There may be other patients that go there for other reasons, but their 80% rule is probably going to be heart disease and heart health related issues. So, when you're on the prospecting webinars, we often use these numbers. 75 to 80% of patients, when surveyed, are already taking some form of health supplementation products, and they want that advice from their health professional. So we're focusing on the primary challenges of the practice. That's the 80% rule. So how do we do this? We identify the main concern, whether it is cardiovascular concerns, blood sugar support, digestive health. I'm having trouble thinking of a fifth one right now, or fourth one. But you get the idea. We're going to try to figure out what the best solution is for the mass, for the majority of those patient base. And we're going to, in a way, focus a little bit on price, but we're going to step away from that when we're talking about directed system support. And I'll talk a little bit more about why when we get there. So small, medium, and large can take on different meanings. It can absolutely be about price and budget. And that's always going to be concern for the health professional when we're consulting with them. But small, medium, and large can take on different meanings. It can also be about the wellness goals of the patient. and how we can support them depending on what their goals are. It could also take on a meaning depending on how well the doctor understands how to use nutrients in their practice. But what it really means, and I want to be very clear, what it really means is finding the right combination of product support to positively impact the patient. And that's directed system support. So it's not about price anymore. That's always going to be a factor. So please hear me when I say that. But what we found is because of a lot of NC's personal price objections or personal sales objections, what was happening is that, let's say, I'm going to use this as a random example, to target joint discomfort, yes, vitamin C is going to be helpful, but is vitamin C alone going to help the patient with their joint discomfort issues? And yes, vitamin C is one of our more inexpensive products, but by only providing that as a small option to a patient, then it's really not providing them with the end result that they're looking for. And if you think about that in the bigger picture, if the products that our health professionals are recommending, based on our suggestions, because we're their conduit, isn't giving their patients the relief or the results that they're looking for, then nutraMetrix isn't doing anything to help them. And yes, nutraMetrix will look like an expense to that practice. But if we can work with our health professionals, and this does require us to become educated on our products, to get to general product trainings, to get to product symposiums, so that we can speak impactfully and efficiently about the benefits and the structure support that our products and services provide, then we can put together packages that are going to support what the health professionals' patients are really looking for. So let's talk about directed system support for a primary concern. Let's use joint discomfort, for example. So a small option is going to be the smallest combination of products that's going to give the most impact for that primary concern. It might be one product. It might be two products. It might be a product kit. So small is not about necessarily price. It's about the smallest combination of support that's going to directly support the system that the health professional is looking for. The medium option is going to be additional support on top of the small. And a large implementation is going to be an all-inclusive support. So we're going to be building upon things. So in the old version of small, medium, and large, really the point was to get most of the patients onto the medium. And if you think about this, I don't know when the last time you moved, but I did this when I moved a few years ago. I called 3 different companies, 3 moving companies, and I chose the one who gave me the middle price. And that's the general mentality of most of us. But really, we want people to focus on the large option because it's going to provide the results that the patients are looking for. And if cost is a concern, then the health professional has the ability to say, okay, I understand that the cost is a concern. Let's talk about a smaller option of support. I believe this will help. This will be beneficial for you. And when you have more budget, or it's not working as quickly as you would like, for example, then we can talk about adding some additional support. But if you think about it, I'm actually going to pull up a proposal for small, medium, and large for joint discomfort. So in this example, and I want to be very clear, this is not the be-all and end-all for joint discomfort. This is something I threw together as an example. In fact, as I looked at the large option, it would not really be what I would put together. I just did this as an example, okay? So a small option to support joint discomfort would be, say, a 30-day serving of OPC and a 30-day serving of vitamin D3 with K2. The medium would be the small option, so OPC3 and vitamin D3 with K2, plus Heart Health Omega-3s and nutraMetrix Isotonics Prime Joint Support Formula. The large option would be everything that the medium contained, plus, say, the daily essential packets. Or you could put together a custom cocktail with OPC and vitamin D and joint support and the ingredients that are in the daily essentials. And then in addition to the heart health omega-3s. And the cool thing with the custom cocktail is not only is it convenient, but in some cases when price really is an objection or it's the final objection, then you could, take one serving, let's say you had 2 servings of OPC and 2 servings of joint support and a couple other things. And let's say that was just over budget for the patient. You could, for example, take out a serving of joint support and you could end up providing them what they need for less than what originally was what they were going to come in for. But let's talk about, for those of you who are still having some issues on price, and you're looking at the cost of the large for $230, let's just say $240, what patient is going to pay that? Well, we're talking about supporting the specific needs of the patient. And again, there are options, but doesn't it make a little bit more sense for us to talk to our health professionals and say, doctor, I totally understand where you're coming from, and I understand that not every patient is going to have a budget for $240 a month. But if you have patients that can start there for fill in the blank, 1, 2, 3, 4 months, whatever it needs to be, and they can get the relief that they're looking for, and then we can have the conversation, or meaning the doctor with the patient can have the conversation about finding a maintenance regimen for them. Don't you think that's in the best interest of your patients? Now, doctor, I understand not every patient is going to be able to afford $240 for 3 months. But again, doctor, it may only be for 3 months. So we have these other options. Here's for $170 a month, and here's for $60 a month. For your patients that are actively looking to support their needs from a nutritional standpoint to get to the core, this is going to be the solution for them. And ultimately what we're going to be doing is we're probably going to be helping a smaller amount of patients, but we're going to be helping those patients. I hope that makes sense. That's where we're going with DSS, Directed System Support. So that's to target one primary concern. DSS can also have another meaning. It could be targeting for multiple concerns. So if you're meeting with a health professional and they're saying my patients come in for, they probably won't say joint discomfort, they'll say something itis, right? And they're also having digestive issues. Then we might put together another kind of DSS that's going to target both things. So the small, if they say the primary concern, the 80% rule of this patient base is coming to them for they're having a lot of joint discomfort issues. Then we're going to put together as the small option a package for joint discomfort. But those same patients are also having digestive issues, so we're going to expand and put some gut health, digestive health products into the medium option. And then the large will focus on the overall health and wellness goals of the entire of the patient population as a whole. So this might be where a custom cocktail comes into play, or it might be where the small plus the medium and then the daily essentials kits or packets come into play. So it can be a lot of things, and I hope that's not, I don't want to confuse you by saying that, but this is really where we as the consultants really need to listen and provide the solution that the health professionals are asking us for. So here's just some more examples. And what we did here is we put together, I wanted you to see this in different examples. So the first one was a proposal. The one that we just showed you was just a sort of a list. And here we're actually using the DSHEA compliant verbiage to support what we're talking about. So here for an orthopedic practice, if the primary concern is knee discomfort or any joint discomfort, we might put together OPC with vitamin D, like we talked about earlier, because OPC supports normal inflammatory response and structural integrity of joints and tendons. Vitamin D supports normal inflammatory response and supports the structural integrity of bone and tendon. So do you see? Because if you, when you saw that first proposal and you're like, really, vitamin D for joints? I understand for bone density support, but we have to really look at all of the approved benefits of our products and how we can use them strategically to support. So a medium product selection would be the small plus additional support for digestive health. So that might be adding nutraclean probiotics. It might be adding digestive enzymes. It might be providing both, because nutraclean probiotics promotes colon health, promotes bowel regularity and stomach comfort, supports a healthy upper digestive tract. And you can, I know you guys can read this, but I'm saying it for a specific reason, because I want you all to become very comfortable with the DSHEA compliant language. Because ultimately we can help more people, whether it's our personal customer base or whether we're working as a consultant in a health professional's office. And by being familiar with and using DSHEA compliant language, which is not only the legal responsibility that we have, but we ultimately will be able to help more people. And I'm going to take a moment to talk about that. If you think about it, if you have a customer of your own and they have something-itis, and you say, take this product, it will help with your something-itis. And guess what? That product doesn't help with their something-itis. Or they thought they had something-itis, but it was really something else. Well, guess what? That friend or that patient, or that client or customer, they lose all credibility in you, in the product, and the company. And they will not make any referrals on your behalf because you told them it would fix their something-itis, and it didn't. So therefore, it doesn't work. But if you say, I'm going to go back a page. If you say, you know what, I understand what you're telling me. I'm not a health professional, if you're not, but I'd like you to think about trying this. It supports normal inflammatory response throughout the body. And let's have you take it at this dosage or whatever you're going to suggest for 30 days or 60 days or 90 days, whatever it is, and see how you respond. Because now you're not promising them anything. You're not going to say, this is going to fix your something-itis. We're going to check in with you, and you've already built in a follow-up system, by the way. We're going to check in with you, and we're going to see how you respond. You might also add, many people respond differently to nutraceutical or to nutritional interventions, and we want to make sure that this is the right intervention for you. So here's 30 days. You're going to take it like this, and let's check in on a weekly basis or bi-weekly basis, and let's see how you respond. So I hope you understand. I kind of went on a tangent, but I hope you understand how important and beneficial DSHEA compliant language really is. All right. That was a tangent. I'm back. Here is our medium product selection. And for the large example, it would be the small plus the medium plus, in this case, it could be daily essential packets, or it could be a custom cocktail that's going to include all the ingredients from the products that we talked about before. You'll notice I put digestive enzymes separately, only because we currently can't put it into a custom cocktail. But it is a nice and easy sort of side sell, especially the travel packets. Because you can just stick them in a bag or a purse, and you can take them with you and use them when they're needed. All right, so that's the big theme of DSS, Directed System Support. I suspect there will be many questions. We're going to move on to the final theme, which is phase 1, 2, and 3. We kind of talked about this earlier because it is hard to talk about one of the themes without bringing the others into play. So the first phase is where we focus on the process of building the implementation. If it's a practice that already has a sales system in place, this is going to be a lot easier than practices that don't. Phase 1 is going to be getting the staff oriented, training the roles of support, and ultimately it's not just the process of the patients, but it's the support system. It's the backbone, really, of the doctor's vision for their practice. And the staff, including the doctor, are important benchmarks or mile markers along the way of their patient's wellness and ultimately the doctor's wellness goals for the practice. So the goal of the first phase is to target the 80% rule, but it's also to build the wheel. I like the idea of a wheel, and each point of implementation is sort of a spoke of that wheel. And if one spoke breaks, meaning a staff member leaves, then we just need to train that new staff member, that new spoke, on what the tasks were of what that role did, what that person did in the practice. Again, that's why we have the whole implementation training, and we teach each individual staff member along the way, if we have that option, if there is a staff, of course, how to support one or two small tasks to support the doctor's vision. The second phase is building on share of customer. So again, like we talked about in the beginning of this module, it could be additional product support for the 80% rule, or it could be to expand to parts of the 20% of that patient base. And all we simply do, once we have the wheel spinning, then all we need to do is add more education on whatever products or services that we're adding into phase 2. And phase 3 is when we talk about the theme of mission, vision, and destination, which was not included in this module. But really where that health professional wants to be in 5 or 10 years. We often use the idea of a custom cocktail or gene snip or TLS being the third phase of implementation, but they can come in, that could be part of phase 1. It really depends on what's needed. The reason why it's a good example is because implementing TLS takes a little more people involved. Gene snip takes a little more, what's the word I'm looking for? I want to say concentration, but that's not actually the word I'm looking for. It's a little more comprehensive. That's the word I'm looking for. So we use those as an example. But a custom cocktail could very well be part of the first phase of implementation. So the tip is to really listen to the health professional, to what their needs are, and put together a program that's based on those needs. Don't allow, if you have price objections, don't allow your objections to get in the way. I think that's the biggest obstacle that anyone moving forward with our DSS system is going to have. So I'm going to go ahead and take questions now. I'll turn off the recording, of course, and